Okay, so guys, how are you doing? Good evening. Well, first of all, I mean, there's a lot of people who are not showing up uh, in are not respecting the schedule, right? So, taking into account the ones that are present and uh, on time, I just let me take a picture of your names and well, I think we could begin with the class, right? Because well, today I am on my 24-hour shift. So let's get started. You can see my screen, right?
Yes,
Okay, thank you. Okay, so we were in the past classes we were talking about parts of the body. This is the second part, as we were in the last class. And as I told you, we joined the parts of the body class and the functions of the body so we can get a better understanding and for you to remember better than you would in separate topics. Okay, so so far we just talked about the cardiovascular system, the digestive system, the female reproductive system, and I think that's what we talked about so far, right? So we're going on. And well, today we're going to talk about the respiratory system and the endocrine system. Okay, the urinary system, uh, well, according to the nephrology specialty, is quite more complex than the urology topic because it's anatomy. Well, the kidney anatomy itself, it's much more complicated than the urinary pathways, right? So tomorrow we're going to be talking about that, the urinary and the nervous system. Today we're focusing on the respiratory and endocrine systems. Okay, sorry. Okay, so the respiratory systems. When we get to talk about the structures that are involved in the respiratory systems, we have, first of all, to talk about the upper airways. You already know what upper means, okay? It's like saying superior, right? And then we have the lower airways. So here we have a slide uh, that will has the structures of the upper airways. However, we are going to take into account some other structures that are higher than what is shown in this picture, in this slide, right? In a next one. So here we have everything that is above. The larynx would be considered the upper airways, okay? They have also determined function. Here we have the pharynx and what is just underneath it is considered the lower airways. So here, the structures that we are seeing here are the pharynx, the epiglottis, the larynx, the trachea, the carina, right, which is the point in which the trachea is divided into the main bronchi. Okay, so let's Let's go on. Here we have the bronchi, the bronchial tree, and the lungs. Okay, the bronchi and the bronchial tree are considered the lower airways. Everything that is beyond those structures could be considered the respiratory uh, parts itself of the respiratory system, because the final structures, the more peripheral structures of the airways have also the capacity of exchanging gases, right? You all know that. Okay, so for pronunciation matters, what is more concerned to this kind of classes? Well, we already talked about the larynx, the trachea, right? The primary bronchi. It divides into the secondary bronchi and the tertiary bronchi. The primary bronchi would be uh, the first division of the trachea, right? Right after that, it also divides, and give me a minute, please, guys. Okay, okay, I'm sorry. Uh, well, the primary bronchi are also called the, uh, um, well, they divide, right? And each one would be, their division would be the lobe bronchi. And these ones would also divide, and we would get the segmental bronchi. Okay, that is the same. Well, it has the same meaning as the tertiary bronchi. Then it keeps well, it still divides, and we have the bronchioles. Okay, and right after that we have the lungs. So, does anybody have a question about the pronunciation? Okay, as we already said, the upper airways start at the nose, right? So we have the nasal cavity, and we also have some sinuses, and these are the paranasal sinuses. You already know this. We have the maxillary sinus, the sphenoid sinus, ethmoid sinus, and frontal sinus. Okay, those are the paranasal sinuses. What do they do? What is their main function? Well, first of all, they are spaces that have air inside them, and they help to moist and to warm the air that is coming through the nasal cavity, right? So, can anybody tell me what this is useful for? I mean, what kind of disease would be associated with the lack of function of the paranasal sinuses? Anybody, guys? We're okay. We have extra points here that we're going to give you if you answer correctly, as we've already been doing it. So what happens if we breathe through the mouth? The air does not moist and warm. Does anybody, well, does anybody know what moist is?
Humedecer.
That is correct. Yes. So the main function of the paranasal sinuses is to moist, to make the air that is going through moistened, okay, to moist that air and to make it warmer, right? So what happens if we breathe through the mouth? Uh, the air does not go through the paranasal sinuses, so it doesn't get warmer and there is no moist action. So when we breathe through the mouth, this does not happen, and the lower airways get this cold and dry air. Okay, and that is directly related to asthma. Okay, when a person, when a person has this diagnosis, as we've already talked about in the first class, I guess, uh, there are crises, right? There are asthmatic crises. You all read about this. So, what are the main? Well, one of the main stimulations for it to have an asthmatic crisis, it is when a person is exercising. Okay, so when a person is exercising and it is a heavy load exercise, this person does not breathe through the nose. So the person breathes through the mouth. So the cold and dry air are one of the main stimulations for uh, an asthmatic crisis. Okay, so it is related to this the function of paranasal sinuses. What else does it do? It amplifies the sound of voice, and what can we relate to in a clinical matter? Well, it relates to the when a person has sinusitis, right? Uh, the voice turns more nasal. That is why the cavities that are supposed to be filled with air are filled with mucus, right? So that's what it would relate to. Uh, Here it says when sounds sound different when clutched. Okay, when they're occupied by some other structure or secretion different than air, then it would be the normal, right? So the nasal cavity cells, the cells release mucus, and it has a function that, well, it has lysozymes that are related to immunology, right? So the pharynx, the pharynx is divided, as you know, in nasopharynx, oropharynx, and laryngopharynx. This is here we have in the larynx, we have it is in Spanish we call it las cuerdas vocales, right? In English, you would refer to it as the voice box. Okay. Here we have the soft palate and the uvula, and there are posterior structures, and the hard palate is an anterior structure, and the oral cavity. Well, here we have a description of the lower airways. So we have the trachea, and this point is also called, as we already read about in Spanish, the carina, right? This is the point where the trachea is divided into the main sting bronchus. As you already talked about, we already talked about the right one, the right main string bronchus is more vertical and wider than the left one. So, and does anybody know what it would be related to? Especially when we're talking about children.
Can you repeat the question, please?
Okay, so here we have the trachea, right? And it divides at this point, the carina, it divides into the right main stem bronchus. Let me get my pointer here. There it is. So the trachea at this point is the carina, right? It has the same name as we all read about in Spanish. At this point, the trachea is divided into the right and left mainstream bronchus, right? So the right one is more vertical and is wider, as you can see here. Is wider. What does wide mean? Just wide, without the R. Wide means ancho, okay? So the right one is wider and more vertical. The left one is horizontal. Okay, so what mm, might be this structure, the right bronchus, related to any kind of pathology, any kind of disease, especially in kids? I know, well, when you introduced yourselves, you told me that some of you already are senior students. I mean, you're in your last years, and I'm sure you already saw this the pediatrics area. So in pediatrics, when well, you all know that children tend to put many objects in their mouths, right? So they may swallow it, and some of them may not go through the digestive system, but they would go through the airways. Okay, so any object would be more related to, well, any external object that this kid has inside of him, of course, in his airway, it would be related more to the right bronchus. Okay, it does not tend to go to the left one because this one is more horizontal, and the right one is more vertical and is wider. Okay, so external objects tend to go to the right side. Okay, and any object that reaches the lower airways, what would happen to the patient? Does anybody know? The airways would be blocked, right? Because there would be any kind of object. So the section of the lung that is supposed to get the air from this blocked airway, what would it happen to this section of the lung? Come on, guys, you're going to be doctors. I'm sure you read about it. You're shy or something, right? Uh, I'm sure you read about atelectasics. Does anybody know what an atelectasics is?
Yeah, es un colapso del pulmón.
Okay, yes, the alveolus and the alveoli collapse, right? Because they don't get air. So they are expanded, they don't get air, so they collapse, they shrink, right? Yes, that's the correct answer. That's an atelectasic. What's your name?
Danitza Zambrano.
Okay, Danita. So that's what would happen. Okay. So here, as you all know, the right lung has three lobes, and that is different from the left lung. The right lung has the upper, the middle, and the lower lobes. And on the other hand, the left lung only has the upper and the lower lobe. How can we see, where do we see the middle lobe in an X-ray, in a chest X-ray? Does anybody know? It's not like, oh, well, here we are seeing it in a diagram, right? Which is not 100% correct, because this middle lobe is not in the front, it's in the back actually. So if we take a chest X-ray, we would not see the middle lobe in a posterior anterior direction of the X-ray. We would see it from behind. So we would, to see the middle lobe of the right lung, we would have to take a lateral uh, X-ray of the chest. Okay. So here we have this. Second. Okay. Well, as you all know, the airway keeps dividing itself until we have terminal bronchiolitis. That is the pronunciation, okay? Bronchiolitis. So at the end, we have respiratory bronchiolitis. What difference is between the terminal bronchiolitis and the respiratory bronchiolitis? The respiratory bronchiolitis also have some alveoli, okay? So uh, the unit to exchange of gases is the pulmonary alveolus, right? This is something like a sac of air, and I don't quite remember the size of each alveolus, but I think it's around 160 to 200 micrometers. Okay, and each one of both lungs have around 500 million alveoli. Okay, so this increases the exchange surface of gases, and it is around 140 square meters. You all read that famous quote that it would be similar to a tennis court, right? So that is why the alveoli, putting together all the surfaces that we're talking about, it would be around 140 square meters. So this, the architecture of the respiratory tree starts, as we already said, the trachea, and it would reach the carina and divides right into the right and left main bronchi. So right after that, we have, well, here we have an alveolus, and it's not represented here in the diagram, but it has three layers. Okay, the one that is well is like continuously the continuous of the upper airway and the lower airway will be the epithelial one. Right beneath the epithelial layer, we would have basal membrane, and right underneath it, we would have the endothelium of the vessels that are reaching the pulmonary circulation, right? So in this epithelial layer, we have two types of cells, which are the pneumocytes. These pneumocytes are the type 1 pneumocytes and the type 2 pneumocytes. What is the, well, what, does anybody know what kind of pneumocyte is more common in an alveoli?
Type 1.
Yes, type 1 is the most common one, right? It's around 95%. It's like most of the epithelial layer is represented by type 1 pneumocytes.
Mhm.
Okay, thank you. So tell me your name so I can give you the extra points.
Valeria Guerra.
Okay, Valeria, thank you. So as we were saying, only the 5% of the pneumocytes are represented by the type 2 pneumocytes. However, this is like well, this gives the potential of regeneration of the layer of the epithelial layer, because type 2 pneumocytes can turn into the type 1 pneumocytes. That is its importance. It is also important that it secretes the surfactant that is, well, I'm sure you all know what does this molecule surfactant do? It prevents the collapse, right, of the alveoli. Okay. Does anybody know what is the name of the disease in which a newborn is, well, when a newborn is premature, he does this, newborn does not have this molecule because it's premature and does not have enough of this molecule. So this newborn would have a disease. Do you know what disease it is?
Can I say it in Spanish?
Okay.
It will be like síndrome de dificultad respiratoria.
Okay, it would also be related to it. Yeah, thank you. Okay. Tell me your name, please.
I'm Marcela.
Okay, Marcela, thank you. Okay. So, as you can see here, type 2 pneumocytes regenerate and replace damaged cells. So type 2 pneumocytes can turn into type 1. Okay, that's its importance. So we already saw this yesterday when we were talking about the the pulmonary circulation, right? I think that there's need for us to go deeper inside this topic. Okay, so you already know this. The gas exchange is the hematosis, right? So the pulmonary ventilation. Does anybody know what ventilation is? What is the difference between breathing and ventilation? Well, ventilation is a like a mechanical process, okay, in which the air goes in when we breathe in. You know, it's obviously there's air going in, and when we breathe out, the air is going out, right? So all the mechanics of this procedure is called ventilation. Okay, it is a process of in which the air is in each respiratory cycle and goes through the airways up to the alveoli, and then it goes up through the respiratory, well, through the through the airways and reach the upper airways and go out, right? And it is also divided in inspiration, which is the entry of air, and the expiration, which is the way out when it goes out. It the main responsibles for pulmonary ventilation, as I told you, it is uh, a mechanical process. Then the most related structures are the respiratory muscles, especially one which is the diaphragm, right? We already talked about it. And the muscles that are between the ribs, okay, intercostals muscles. These muscles are highly, have a lot of nerves, right? Are highly innervated through some famous nerve, which is the phrenic nerve, right? And nerves that go right through the ribs. It follows the lower edge of each rib, right? When it goes through the lower edge of the rib and reaches the anterior segment with a vein, of course, and an artery. This is also important for us to, for example, when we have the diagnosis of pneumothorax, we have to recur to a certain kind of procedure, which is thoracentesis, right? We have a pleural, it's called pleural effusion, which in Spanish would be derrame pleural, right? So the importance of this anatomic knowledge is that we should avoid making contact with any kind of structures that are related to the nerve, the artery, and the vein. So we can damage these structures, and it would be more complicated for us, right, and the patient. So we'll go on with the endocrine system. As you all know, the endocrine system has a lot of organs or glands that are related to it. The main function of it is to release hormones through the bloodstream, and it reaches the target cell, right? In which these molecules are going to take action. So at the end of the day, the endocrine system helps to establish homeostasis, okay? And it is also a balance, the homeostasis, right? So when we're talking about the structures, we have two main groups, right? The steroid hormones and the non-steroid hormones. The steroid hormones are derived from cholesterol, and they're hydrophobic, which it's like they do not tend to act in a good way in an aqueous matter. So the steroids, that is why when we're talking about bloodstream, well, it has to go through the bloodstream to get to the target cell, right? However, since they are steroid hormones and they are hydrophobic, they bind. And this is important for us in a matter of literature, because in most of the books that we already read, they tend to establish the main language to English. So when we read mm, the letters that represent any kind of hormone, it is related to in the English name of each hormone. So when we talk about the proteins that are related to the transportation of each molecule of any kind of hormone, in this case, especially the steroid hormones, we use the term bind, which is in Spanish like unirse. Okay, so to bind any kind of steroid hormone, it goes through the bloodstream and reach a target cell. They're mostly sensitized in the adrenal glands, which are right above the each kidney, the ovaries and the testes. Okay, that is how we call in Spanish testículos, right? Testes. It's like the second E is pronounced like an E
Sorry,
itself.
I have a question about testes. No se dice también como testículos, así como bien parecido en español, pero en inglés o solo es testes.
Uh, it is also called testicles, right? You might have heard the term testicles. Yes, in Spanish we have also the term testis. I don't know if you read it in Spanish. It is read testis. In English, it would be testis. Okay, like an E. And the second E is like an E, so it would be testis. Okay. Any other questions? This is easy, right? So when we're talking about steroid hormones, well, since they derive from cholesterol, they go through the phospholipid membrane of the target cell quite easily. It does not require receptor at the cell membrane, so it goes through. When it is inside the cell, it binds to a receptor, an intracellular receptor, and when they bind together, they go right inside the nucleus and activate genes according to an specific hormone, right? And on the other hand, we have the non-steroid hormones, which are two. Okay, we're talking here about the peptidic hormones. Well, since we're talking about peptidic hormones, they are like branches of amino acids, right? So they are hydrophilic. They are the opposite of hydrophobic, that are the steroid hormones. They never enter the cell, and this is important because they travel through the bloodstream and they join, they bind to a receptor which is at the surface of the phospholipid membrane of the target cell. And the receptor changes its form. Okay, let's imagine here that it's before it binds to any kind of peptidic hormone, it would be like more roundy. Okay, this receptor, imagine it would have a more rounded structure. It would be like a circle. Okay, then it joins, it binds to the peptidic hormone, it would change, and then it changes its shape. Okay, and inside of this cell, there's there are some types of enzymes that activate each other, and the final one was, for example, you must have read about tyrosine kinase, that kind of enzymes that are linked to receptors that are at the surface of the phospholipid membrane, right? So at the end of any kind of enzyme pathway, there is a molecule that reaches the nucleus, and that molecule changes the expression of some genes. When we talked about the steroid hormones, and the hormone itself joined or binded to its receptor, traveled through the nucleus, and the hormone itself changed, right? The gene expression. And then we have the also non-steroid hormones, but this would be the amino acid hormones that are hormones that are related to one or just a few amino acids. And they derive from certain amino acids, okay? So like here we have an example, the thyroid hormones. This is pronunciation, thyroid, okay? Thyroid hormones, they behave like steroids because they are hydrophobic. They have to bind to a protein that binds it and goes through the bloodstream, bind it to it, right? Then, as in the steroid hormones, they travel until they reach the nucleus of the target cell. And then we have some other hormones that behave like peptides. Uh, here we have the adrenaline and noradrenaline, also known as epinephrine and norepinephrine, right? So they bind to, well, they travel alone and then bind the receptors that are at the surface of the phospholipid membrane. Then, as we were talking about the peptide hormones, uh, there's the activation of some enzymes inside the cell, and this, well, at the end of the pathway, there's an enzyme that travels to the nucleus and would change the gene expression. So there are different kind of hormones that act in a certain way, but here, when we're talking about non-steroid hormones, they could also behave like steroids or like peptides. Okay, so here we have the hypothalamus. Notice pronunciation, hypothalamus. Yeah, remember th, how it sounds. Putting your tongue between your teeth and like blowing, right? Hypothalamus. So here we have the hypothalamus at the base of the brain. It is linked to another structure, which is the pituitary gland. As you all know, the pituitary gland has two lobes, right? The anterior lobe and the posterior lobe. The anterior lobe is glandular tissue, and the posterior lobe only has axons. These axons come from two nucleus, the paraventricular and the supraoptic nucleus that are here at the hypothalamus. What is important here is that, well, when we have this, any kind of a stimulation to the hypothalamus and, for example, an increased osmolarity, right? Well, there are some structures here that are saving the hormones inside the axons. So when the bodies of these neurons are stimulated by any kind of center that it has, uh, it would release a certain kind of hormone that is already saved here. On the other hand, in the anterior lobe of the pituitary gland, it connects, as we are going to see in, I think, some more slides. It connects through this structure that we're going to talk about. So the hypothalamus induces the production of hormones through the pituitary gland, as we already talked about. For example, yesterday when we were seeing the female reproductive system, right? So any kind of information from the body that is sensed by the hypothalamus, it will produce a certain kind of hormones, and it will go right to the anterior or posterior lobes of the pituitary gland, and it will secrete, in case of the anterior lobe, any kind of hormone related to a certain axis, right? And in the posterior lobe, as I told you, the hormones are saved in this posterior lobe, and when there's an stimulation to the hypothalamus that goes through the stem, which this is the stem, goes through the stem, and it would reach the posterior lobe. It would release a certain kind of hormone that is already saved here. So here, when we talk about the hypothalamic hormones, here we have, as I was telling here, here we have the hypothalamus, and here we have the anterior pituitary gland, right? So it connects through the hypothalamo-hypophyseal portal system, which in Spanish would be a sistema portal hipotálamo hipofisario, right? So it links to this anterior lobe of the pituitary gland through this structure, right? And these kind of vessels. So when we're talking about the hypothalamic hormones, we're going to talk about two kinds of hormones, which are the stimulatory hormones and the inhibitory hormones. The stimulatory hormones are thyrotropin, okay, thyrotropin, or TRH, corticotropin, or CRH, gonadotropin, which we already talked about yesterday, or GnRH, and growth hormone, or GHRH. Okay, so these are the stimulatory hormones, and they are released, right? And because they are not saved. And the ones that are saved are in the posterior lobe of the pituitary gland. So, for example, here we have the examples of the stimulatory hormones of this axis. So here we have the hypothalamus. It releases TRH, makes the pituitary gland to produce thyroid stimulating hormone. As you can see, the letters that are related to the names of any kind of hormones here are taken into account when we're talking about English, right? So that's how you're going to find it in your books. So it produces thyroid stimulating hormone, or TSH, makes the thyroid to produce, actually it has, well, the thyroid hormones are already saved here. However, they are released in a more efficient way to the bloodstream, and has its target cells to have a specific action of each hormone, which we're going to talk about when we talk about the diseases related to thyroid. Okay, then we have this other axis, hormonal axis, in which the hypothalamus releases CRH, right? Goes to the anterior lobe of the pituitary gland, and it makes it release this hormone, which is adrenocorticotropic hormone, or ACTH, right? And this hormone goes to the adrenal glands. Notice pronunciation, adrenal glands, that you know, all know that are above each kidney. They release cortisol and go to the bloodstream, and this is a negative feedback mechanism, right? When cortisol levels increase, this negative feedback mechanism will stop the hypothalamus to still be producing the CRH. And we already talked about it. However, we're going to make a quick recap. The hypothalamus releases these GnRH to the, you know that, well, I explained yesterday, I guess, that it's released in pulses, right? So it depends on the speed of the pulses for the response of the pituitary gland, and it will release the gonadotropins, right? Which are the follicle stimulating hormone and the luteinizing hormone, okay? What is this hormone? Well, this kind of hormones going to do? They are going to alter the production and maturation of gametes. Notice pronunciation, gametes. Okay, at gonads. Okay, so it will alter the production of sex hormones such as testosterone, estrogen, and progesterone that we already talked about yesterday. And the hypothalamus also has this one last axis that is related to the anterior pituitary gland. That is when the hypothalamus releases GHRH, which is the growth hormone, right? Well, it would mean growth hormone releasing hormone. So this is the hormone that makes the pituitary gland to release growth hormone, right? So the pituitary gland, the anterior lobe, produces and releases growth hormone, and it makes, well, it has a lot of actions. However, the most known one is that it makes long bones to grow, right? As its own name says. Here we have the inhibitory hormones related to these glands. Okay, so here we have the hypothalamus and the pituitary gland, and well, here we have these two inhibitory hormones that are the growth hormone inhibiting hormone. So it inhibits the production of growth hormone, right? Its name, it is also known as somatostatin. Yesterday, we already talked about this hormone. Does anybody remember what kind of cells it is also secreted by? Somatostatin. It was related to the digestive system. I mean, the anterior lobe of the pituitary gland releases somatostatin, right? However, there is another tissue that releases this hormone as well. Do you remember which one was it? The D cells, right? That are found in the stomach. It is the antrum, okay? At the stomach, the D cells also release somatostatin. The somatostatin makes the G cells that are also in the stomach, and they make, well, they reduce the production of gastrin, right? So it is also produced in the anterior lobe of the pituitary gland. And the last one is the prolactin inhibiting factor, which is the dopamine, okay? So when, well, this question will be directed to the senior year students, because this is a kind of tricky question. When a woman that just gave birth, I mean, just had a baby, and this baby that is not alive anymore, the mother would be secreting milk, right? Due to hormonal factors. So we can, as a psychological treatment, we give this mother a certain kind of medicine, a drug that inhibits the production of milk. It is related to it. Does any senior student know what kind of medicine it is? What kind of drug it is? I mean, it would be really harmful to lose your baby and still be secreting milk, right? For the mother, I mean, it would be terrible. I mean, the newborn just died and she's still secreting milk. It would be terrible. So here we can give some kind of drug to make the secretion of milk stop. Does anybody know what it is? Okay, that's homework for you guys, okay? So guys, I think we're done for today's class because as I told you, I'm on my shift. Tomorrow we're going to finish this parts of the body and functions of the body topics, and then we're going to have the practice class, okay? Does anybody have a question, especially about pronunciation of any structure or hormone that we talked about today?
So far, so good.
Okay, so guys, I guess I'll see you tomorrow. Have a good night. First, I'm going to give you, show you the poll, okay? And I'm sorry if I have to go kind of quick today because as I told you, I'm on my shift. So here you have the poll. When you're done, let me know.
I think.
Okay, thank you. Okay, thank you guys. You all, the 10 people that are, well, that joined the meeting already are already done. So we're going to finish today's class. Have a good night and see you tomorrow, okay?
Good night. Bye.
Bye. Goodbye.
Bye.
Thank you. Bye.
Bye.